Well, good evening. I recognize quite a few of you. You've been in my classes, so you probably won't be surprised to hear what I have to say. But you will no doubt be surprised by my ability to say it in the 10 or so minutes that I'm allocated. That will be a novelty. Those of you who haven't studied with me will probably be surprised by both what I have to say and how long I take to say it. I also want to apologize for my lack of full technological capacity. I'm perhaps lagging by 20, 30 years. I came in with 2 overhead slides, but there's no overhead slide projector here. This is a big advance from my usual chalk diagrams on Blackboard. And so I will try, since I built some of my presentation around these 2 very clever cartoons, that I will try to summarize these cartoons, and if anyone would like these cartoons, I'll make them available to you in some other way. I should say, from my point of view, that I have much in common and a great deal of overlap with both speakers. I don't agree completely with either of them in emphasis or in specific points, but there is a great deal that we share, and that will no doubt come out in the conversation when we get to that stage of our evening. But let me stake out my rather different position. And I'll explain to you that I'm disturbed by so much that's not in play in the current debates and political process, not so much by what is in play. What's in play, in fact, and it was very aptly summarized by Mr. Goldstein, is very complicated, but it also shifts sometimes even daily, so that it's difficult to keep up with it and very hard to, in this stage of the political process, to come to a definitive conclusion, because it's an unstable process, keeps changing, and I think it would be really a waste of most of our effort to focus on the local variation of the day when we haven't reached a point of equilibrium and stability, and then we can home in. At that point, there'll be plenty to home in on, and a lot is going to be in those devilish details. Remember, the devil is in the details. Don't be misled by nice phrases and broad principles when you examine the legislation that's finally put before Congress, but look at the details that go beyond the words and phrases and the gestures. But what, as I say, disturbs me is that President Obama and current allies like Senator Baucus, not so much Nancy Pelosi, but Senator Baucus, have put in play a series of options that leaves out some critical parts that should be in any reasonable debate. They leave out single payer, that is a Canadian style, or Medicare for all option, and they don't even now include a robust public option as part of what at least the Senate is considering. President Obama has said on numerous occasions, most recently in an important July news conference, that the single payer, that is the Canadian-style Medicare for all option, would be most cost-effective and would achieve universal coverage, which none of the present options would do, even at their optimum realization. And it was pointed out by Mr. Goldstein, some 21 million or so people would be left out, even if Senator Baucus got everything that he claims to want in the current legislation. And put that in very pragmatic terms. Every uninsured person has a great risk, even with the supposed safety net of emergency care, and we'll have to talk about that in more detail later. What's guaranteed is that people in emergent situations are seen and not thrown out of the emergency room. But it doesn't guarantee that they're not asked to pay and may be hounded by credit companies and etc. There are implications that condition people's behavior so they avoid going to the emergency room for fear of the consequences in their lives, to their credit ratings, to their garnished wages, and so on. Whatever ultimately is decided, the bottom line at the end of the day in terms of balancing the hospital budget. But that's largely a side issue. The current estimate is that somewhere between 22,000 and most recently 45,000 people die every year because they do not have health insurance, which is the major ticket of access into our healthcare system. And yet, President Obama, who knows this, he's a very clever man, I have great admiration for his intelligence, Yet he avoids talking about a robust public option or more. And as he made explicit in his September 9th speech, he was basing his exclusion on a clear political calculation, which I read to be that as soon as he utters the word robust, or the phrase robust public option, or the phrase single payer, many will shout socialism, or worse, and the discussion, any rational discussion, will be over. Any plan off the table. Debate stopped. But this isn't rational discussion or legitimate debate. In fact, it's a reaction that has nothing rational or even cognitive at any level about it. It's preconscious, thoughtless, literally, knee-jerk, reflex reaction, a conditioned Pavlovian reaction that is built into our political culture and that is manipulated by special interests who want to keep things the way they are. Remember Pavlov's dogs. First they were presented with meat and they salivated and their stomach juices churned. Then they were conditioned to respond only to the bell that was simultaneous with the presentation of meat. Bell rang, saliva juices were produced in abundance, and digestive enzymes churned. It is that kind of automatic reaction. Our bell, in our culture, well known to those who want to preserve their own special privilege, is socialism. And as soon as it sounded, people react. It passes through pathways that bypass the brain in any rational operation. President Obama knows this. He's very shrewd politically as well as incredibly intelligent analytically. And he is making a calculated political choice to avoid this hysteria so that something can be accomplished, and a lot of his presidency rides on something being accomplished. He wants to accomplish something, and will, I predict, take credit for whatever is accomplished and say we achieved healthcare reform, even if he knows it is far from what would be ideal and maybe even heads us in the wrong direction. And you know how easy it is to turn around an aircraft carrier once it's moving in the wrong direction. So let me look at these claims about socialism. What do they really seem to mean? That any kind of public provision of human services, any kind of government involvement in human services is somehow inappropriate, un-American, socialistic? This is ridiculous. Are police services socialistic? What about fire services? What about the public library, where we use public monies to pay librarians to give you books so you can read and think? Socialism, clearly, or worse. What about public education? Are these bits of socialism? But the history has shown us that special interest groups in the healthcare field have been able to attach socialism to medical care and somehow exempted this human service from all the others. And there is no logic to that, but there's a lot of politics. Here's where I would have shown you my two cartoons. So let me simply describe the cartoons. I think you get the image of them fairly clearly. There's a family riding along in a car, and they're listening to talk radio which is saying, public option healthcare, that smacks of socialism. And underneath, the bottom reads, yes, as they listen to talk radio on government-controlled airwaves, in a vehicle from a government-bailed-out company, driving on a government-built interstate highway, this publicly educated family is sipping water from a municipal water system on its way to a vacation at a national park. Get the point. And here's another cartoon which shows two old geezers, and I can use that term because I'm an old geezer too. I surely qualify by my age cohort, who are standing at a window which reads, collect Medicare and VA benefits here. And these two rather unseemly characters are standing there. One is wearing a t-shirt with no Obama across the front. The other one is wearing a t-shirt that reads, I love, I heart big insurance. They're carrying signs, don't change anything, and be afraid, be very afraid. And one of the people in this group is saying to the woman confused at the window, Can't you hurry up? We're late for a big anti-socialized medicine rally as they collect their benefits for VA or Medicare services. And so, we also have to add to the fact that about 45 to 50% of health care services in the United States are already paid for by public funds. And if you count tax subsidies and foregone revenues and so on in a very complicated tax code, you might even have 60% of our health care paid for out of public funds. Most of these public funds, as in the current Medicare system, for those over 65, goes into the private system of providers and insurers. And that's the major problem. The public is asked to shovel money into the furnace of the private system, left unreformed, and to pick up the bill. There's a complicated issue of the seeming inflation of Medicare and Medicaid rates and the supposed bankruptcy of the Medicare Trust Fund. These are issues I hope that we can come back to in our panel discussion. It's not quite what it seems. In fact, it's quite different when looked at closely and analytically. It's not that simple. Some public money pays for a truly socialized system that we do have in the United States. Medicare is not. Medicare is a social insurance system, leaving all the private providers, hospitals, and individual physicians intact, providing simply a different mechanism of financing. But we have a truly socialized system with salary doctors and government-run and globally budgeted for hospitals. It's called the Veterans Administration System. Now, surely there are problems with the VA system, due primarily to stingy budgets, and you can run down any system. Even I would hasten to say, Strong Memorial Hospital and Highland Hospital, as excellent as they are, if they're stingily budgeted, and this is, I think, much of what Mr. Goldstein is worried about, they can run down too and become much less excellent than they are and become downright bad. You can starve any system. You need not only to have a good system and competent people running it, but you need to have adequate budgets. And much of the problems in the VA system comes from inadequate budgets. And I'll ask this question: if our socialized system of the VA is so bad, so how come our presidents get their checkups at the National Naval Medical Center in Bethesda? And how come even President Reagan, who was most consistently opposed to socialized medicine, even got paid for it at an earlier stage in his career to attack Medicare in the 60s? If he was so opposed to socialized medicine, why did he go to the National Naval Medical Center in Bethesda and have his cancer surgery there? And why did he allow his wife Nancy to have her mastectomy there? Think about it. All sorts of rigorous analyses in our leading medical journals, the Journal of the American Medical Association, New England Journal of Medicine, Health Affairs, etc., have verified repeatedly that we could save something like $350 billion per year if we move from our present bloated, substantially profit-driven, multi-payer system and move to a single-payer system, if we could do it politically. We would thereby cover all the presently uninsured, and we would not have to raise substantial taxes, perhaps none at all, and would not have to impose user fees, penalties, fines, and all the crazy options that are in the mix right now. Why are they in the mix? Because President Obama has painted himself into a corner by not allowing serious discussion and debate about public option and single payer. It is, in short, and I hate to say it because I so admire him in so many ways, it is a demonstration of a lack of political backbone. The courage to stand up and act on what he believes and has made clear he believes, to stand up to the hysteria and the manipulation of public fears and reflex reactions produced by the special interest groups. We need to move beyond that and have the political courage. I very much like President Obama's September 9th speech for most of it. I particularly liked his clear articulation of the issues and problems we are facing, the need for reform, or all head over that cliff and be doomed in ways that have been already clearly laid out. But two things really bothered me about President Obama's speech. Two major, obvious lapses in logic. Lapses that could only be explained not by his lack of intelligence, but by his political calculation. He said early on, I dismiss single payer, it's too radical, but we have to build on what works. Well, Medicare has been in this country and by and large working and will work when the trust fund issue is fixed, and it can be fixed by political will. Medicare has worked, why not build on that which works? And we know the difference in overhead and so on and complicated administrative costs between that system and the private system. We would save so much money if we built on that system that works. But illogically, that's not part of our experience, and it's off the table. That doesn't follow. Another very interesting moment came when towards the end of his speech, he said, we have a very wonderful higher education system in which we have superb private institutions of higher learning and superb public institutions of higher learning, the state college system, state university centers, and so on. Why not have a mix like that? When he seemed to be flirting again with public option and then backed away yet another time. Why not carry that by analogy into the healthcare system? But then he added, completely illogically, that in the public option that we can consider, I will have no tax subsidization. I will have no tax revenue plowed into that system. If there's a public option, it will have to rest only on user fees. Well, that's like saying every excellent public education system has to rest only on the tuition fees collected from its students. There is no such public education system in this state or any other. And think not only of our great universities and colleges in this state, but think of the California system, the Michigan system, and so on. They all use substantial tax resources to help balance their budgets and bring them to levels of excellence. We at the private University of Rochester use substantial tax resources too to balance our budget and so on. Why exclude them? It's illogical. It's a major lapse. President Obama is too smart to miss his own logical lapses, but he clearly made a political calculation to try to get something done in a hostile and often irrational and emotionally overwrought climate. I would prefer true moral leadership in the great tradition of Dr. Martin Luther King, whom he admires so much. Carry it forward. I think we should accept nothing short of universal coverage, and the best way to get there, acknowledged by President Obama himself, is a robust public option, a Medicare for all system. It is not only on analysis the most cost-effective thing to do, it is the only morally and ethically right thing to do. And I have that as my final point for now.
We'd now like to open the floor for questions. If you have a question, please raise your hand and we'll call on you, and then you stand up and ask it to the panelists.